Okay, so what did we do?
Breast implants.
Wow. And that's all we did?
And a lift.
Okay, why don't you explain? So, what?
I got, on this side, we did the transumbilical, and then this side was an incision.
Right. And why was that?
Because they were very different.
How different?
Sizes.
Explain.
This one was a lot larger. This one was small. And so this implant is $250 and this one's $375.
Okay.
And now they're pretty symmetrical.
Yeah.
Yeah.
And what about the breast? Was one sagging and the other one not?
Yeah, this one was pretty saggy. And
Yeah.
this one was just small.
Yeah, so there's three degrees of sagging. The left breast has 0. No sagging at all. We call it ptosis. The right breast had a degree of 3, which is the highest degree of sagging. So that's why we had to do an open breast lift reduction. We try to make that breast smaller, but we didn't do an anchor lift. In other words, she only has a lollipop incision, a little bit of an incision around the nipple. We made the right nipple smaller to match the other nipple, and on the left side, and we did a vertical incision, which you can see is covered with the stair strips that are completely dry and clean. Now, just to clarify, the right breast got a 250 ml and it was inflated with 250 ml of normal saline. The left breast has a 350 ml and was inflated to 375 ml of saline to achieve. So because the left breast was not sagging, we're able to do a breast augmentation through the belly button, and she chose saline implants. We could also have put in silicone, but she decided to use saline implants, and we went through the belly button. My question to you guys is, I'm a question to you first and to the people in the audience too. Where is her incision in the belly button? Huh? Can you see it? It's honestly, and I'm sitting right in front of her at the same level, and I cannot even see it. Tell them where it is.
I can't see it.
It's incredible, right? So I did it. And what about that ring? You asked me, can I put that ring back? Is the ring opening still there? I can see the opening of the ring in the belly button, but I cannot even see the incision. Why? And I'm going to give you a close-up because the incision is I'm going to go under the hood. You can see it there barely. You can see that incision is incredible. And how long ago was this surgery? Yesterday. And you're standing straight up here, right? And any bruising or bleeding?
No.
No bruising or bleeding. You cannot see any bruising or bleeding. People don't believe it. We put this on TikTok and they say, you're lying. What do you say to those people?
You can see there's no bruising.
Yeah, and the surgery was done yesterday, right?
Yeah, yesterday.
That's incredible, right? And how much did you walk today?
About half a mile.
Half a mile today. Yeah. So one more patient, they cannot all be lying, okay? And she's very honest and very truthful. And do you have any significant pain?
I'm a little sore, but that's
a little
normal.
Sore after this type of surgery. Yeah. Well, I'm going to elaborate on that because a little sore after this surgery that normally is brutal, because we get patients that say, you're lying, it's impossible, I'm 3 months out and I am in severe pain. And you know what? It's true. That's the way it is, especially because we put it under the muscle and every time you breathe, it hurts. But we have a different technique. You have to understand, my technique is almost unique and completely different. So she's not lying, she's telling you the truth. And I'm not lying, I'm telling you the truth. This is a different way of surgery with no bruising, no bleeding, and an incredible recovery. And the fact that you cannot even notice her incision on the belly button. And of course, on the right side, she's going to have a scar. But that was inevitable because she had the highest degree of sagging. What do you think?
So far, so good.
And are you pleased with the symmetry
I
that
am.
we achieved?
Yes, very.
Because this was a huge
Yeah.
difference. You had like about 300 ml, more than
Yeah.
a cup difference between the two breasts. They were completely different.
Yeah.
And so now they're not equal, but they're more symmetrical. They're not twins, they're sisters, and that's the goal. And she understood that well. Well, thank you so very much for your testimony here on the next day. And the implants are a little high. Obviously, that's normal because of the swelling and all that. But they will come down in time, in due time, right? We say that basically the implants will drop by 80% at 6 weeks, 90% at 6 months, and 100% at 1 year. So this is not the end result, okay, you guys? She's only gonna get more beautiful as time goes on. But this is 1 day out, you know? How many patients have you seen 1 day out? This is incredible. Thank you.